Good afternoon, everyone, and I really want to thank everyone for being here. And first, I want to thank the Hope Street Merchants Association who sort of let us co-op their street fair today. So I hope after everyone leaves, they'll go and be part of that. Thank you, everyone, for being here. I want to thank Mayor Diossa, Councilman Jackson, Teny Gross from the Institute for the Study and Practice of Nonviolence, Sydney Montstream-Quas, and all of the members of the Rhode Island Coalition Against Violence for being here, but more importantly for the work that they are doing to help end gun violence in our state. And I particularly want to thank the brave survivors and family members who have had family members who have been victims of gun violence who are also with us today, who are an incredible inspiration for all of us as we try to do this work. The recent tragedy in Santa Barbara is the most recent reminder that we need to do more to ensure that weapons don't get into the hands of seriously dangerous individuals. One common denominator in almost all of the major incidents of gun violence, where there are multiple shootings of multiple individuals, is that they are committed by people who are suffering from serious mental illness. And we have got to address this issue before another incident occurs. It's important to say, of course, that most people who suffer from mental illness are not violent, and that we have to continue to invest and fund mental health services robustly so that everyone who needs treatment has access to it. But preventing gun violence should be an area where Republicans and Democrats find common ground and work toward practical solutions. And that's why I've been working on a piece of legislation for many months that we finally completed and introduced yesterday in the Congress called the End, I want to make sure I get the exact title right, but what the bill will do is it will fix our current background check system by incentivizing states to establish systems for mental health professionals to voluntarily report patients who meet strict, dangerous standards into the FBI's NICS system. It will, at the same time, protect patients' privacy rights and allow professionals to fully evaluate their own patients' needs and provide for a very robust appeals process so those that are denied the right to purchase a firearm will have the ability to have that decision reviewed. This bill will equip mental health professionals with the tools they need to report seriously dangerous individuals into the Federal Bureau of Investigation's National Instant Criminal Background Check System to help keep our communities safe and to prevent senseless gun violence. According to a report released by Everytown, Rhode Island lags in mental health reporting among states. In fact, Rhode Island is the only state in the country that has not submitted any mental health records into the background check system since 2011. And as a result, there is a real risk that guns could end up in the wrong hands. Now, there's a commission that the legislature convened, led by Deborah Giro, who I know is working on this issue. I spoke to her this morning. She has legislation that she intends to put forward that will address this issue in part. And this is really a call to action to be sure that Rhode Island also does its part. We need to fix this issue. Yesterday, I sent a letter to local lawmakers urging them to enact the recommendations that would ensure Rhode Island submits mental health records into the FBI National Instant Criminal Background Check System. Many states have already begun to act. Since 2011, state governments have tripled the number of mental health records submitted to the NICS system. Massachusetts state leaders this past week introduced legislation to strengthen their gun laws, including a requirement to require mental health information into the background check database. In Rhode Island, we need to take immediate action to ensure that no more innocent life is lost. And this bill, which is entitled the End the Purchase of Firearms by Dangerous Individuals Act, puts into place a system that will allow mental health professionals to become aware of someone being particularly dangerous in possession of a firearm to prevent those individuals from buying a firearm that they can then use to harm themselves or others. I think everyone agrees people have a right to have a firearm under our Second Amendment, but we should also agree that very dangerous people who have serious mental illness should not have the ability to go into a gun store, buy a gun, and cause harm to themselves or others. And so I want to thank everyone who's been part of many parts of this work, and now invite, I believe, Mayor Diossa from the great city of Central Falls.
Good afternoon. I want to thank Congressman Cicilline for his leadership on this critical issue, and my fellow elected officials and community partners present today for standing here in support of sensible gun legislation. For too long, we have seen how guns and assault weapons end up in the hands of people who have psychological issues, people who are not in the right frame of mind to be anywhere near a gun. The results have been devastating. mass shootings that have inflicted so much pain and loss in local communities and across our entire nation. There has been a lot of debate over gun control measures relating to people with mental illness, but very little action. Currently, a mentally ill person can still purchase a gun even if they have been determined to have a high probability of causing serious harm to others. Congressman Cicilline's legislation would change that by expanding mental health criteria and working closely with FBI's NICS system to identify high-risk individuals. As mayor of Central Falls and a member of Rhode Island Mayors Against Illegal Guns, I support this initiative and urge all Rhode Islanders and Americans from both sides of the aisle to get behind this legislation. Regardless of where you stand on this issue of gun control, we need to take proactive steps towards stopping tragedies like those in California, Connecticut, and Colorado from never happening again. Thank you.
Thank you, Mayor. Thank you, Mayor, for your strong leadership as part of Mayors Against Illegal Guns. I'd now like to invite Sydney Montstream-Quas of the Rhode Island Coalition Against Violence, who has been doing extraordinary work in raising the issues of responsible gun safety legislation here in Rhode Island and as part of a national effort.
Thank you all for being here. My name is Sydney Montstream-Quas. I'm a member of Moms Demand Action for Gun Sense and one of the founding members of the Rhode Island Coalition Against Gun Violence. Moms Demand Action for Gun Sense was founded the day after Sandy Hook. It's a national grassroots organization with chapters in all 50 states and over 150,000 members in the nation. This organization has recently joined forces with Mayors Against Illegal Guns, which hopefully most of you know that Congressman Cicilline was one of the founding members, and Mayor Diossa is a current member. The Rhode Island Coalition Against Gun Violence was formed last year with the goals of preventing gun violence and advocating for effective gun safety legislation. We have more than 25 partners in our organization now, and these partners include medical organizations, faith-based organizations, non-violence organizations, and community-based organizations. With our 25 partner organizations, those memberships of those organizations represent more than 25,000 Rhode Islanders. I'm not anti-gun. I grew up shooting guns, target shooting with my family, which I loved. A lot of members of my family own guns, and I was recruited into the ROTC in college because I had such a good shot. So I grew up respecting guns, learning to handle them safely, and not thinking much about it. Yet the cruelty of gun violence hit my family hard. Almost 16 years ago, my 38-year-old cousin Johnny, the father of 2 young girls, disappeared. Johnny was found a week later in his family's minivan. He'd been shot in the head. His murder shattered my family. It shattered his community. In that instant, we lost a dad, a cousin, a brother, a son, a grandson. And living and working in a safe suburban community did not protect Johnny from gun violence. As a mom, I worry about the safety of my children. I wish I didn't have to worry about gun violence, but I do. I want my kids to be safe. I want them to be safe in my home. I want them to be safe on the streets in their community. I want them to be safe in their schools. But there have been 72 school shootings since Newtown. That's about 1 every 10 days, and that's deplorable. And it's preventable. How can we be quiet on this issue? I want to applaud Congressman Cicilline for his work on enacting gun safety legislation. Data shows that the states with more strong gun laws have less gun violence. In the words of Richard Martinez, the father of Santa Barbara gun violence victim, Christopher Martinez, not one more. He implored all of us to get to work and do something. So please, when we're done here, talk with us, sign some information, work with us to help decrease gun violence and make all of our communities safer. Thank you.
Thank you. I now would like to invite Teny Gross, who is the Executive Director of the Institute for the Study and Practice of Nonviolence, an organization that has done more in Rhode Island to promote peace and to protect the lives of young people than I think any other organization, and who has become a national leader. We use the Street Worker Program as a national model of programs that effectively reduce gun violence and protect the lives of young people. Thank you.
Thank you. Good afternoon. It's good to be here. I am actually against guns. I used to have an Uzi and an M16 as an Israeli soldier, and we understood that a gun for us was a necessary evil. But we never thought to arm civilians against our own country, which is the vision of the NRA. And I've been doing this for 25 years now in the United States, first in Boston and a lot of other cities, and then in Providence, working on gang violence. And quite honestly, there was a racial divide. It was hard to get the attention of the suburbs to gun violence. It's something that people were convinced the NRA was right. Guns don't kill people, people kill people. But this is starting to change. And I see on Facebook now every day on my feed things that even I realize as a professional who works on it, who with my team follows it a lifespan. We do 400 stops at the hospital a year for victims of violence, just here in Rhode Island.
It was a balloon.
Yeah, I know. I'm just stopping to think. Every day now on feed, I get on Facebook and on Twitter, I see things that even I wasn't aware of. I knew the numbers of people who die from homicide, from suicide and accidental gun discharge. But even for me, I knew the victims personally who died in Providence, but someone in Ohio, I didn't know. But now with Facebook, every morning I see a cookout, a 3-year-old discharges an AK-47 that his good guy dad left unattended to. Every day the carnage continues, and eventually we are all being forced to think whether the Second Amendment is just a God-given right with no limits. As you know, a law by definition is a limit. It's a compromise. A society is a compromise. And I applaud Congressman Cicilline for taking the steps on an issue, just so you know, and this is where you can make a difference. Even in our State House, when there is reasonable legislation, the legislators hear 200 times from pro-gun people, and they hear 0 or 10 times, even though we are in the majority in polls, but we don't bother to call. Because a lot of us who are caring people, we care about food stamps, we care about poverty, about businesses, about better school. We have a lot of issues. Guess what? The people who care about guns, they care about guns, and they care about guns, and they care about guns. And we are going to have to change it. Or our children who go to a nice college, or go to a cinema in the suburb, or they go to a political rally, like it happened with Gabby Gifford, or they go to an elementary school in Connecticut, are no longer safe. There's 2 visions in this society. One is going to be a reasonable democracy that compromises the different races, the different incomes, that we live together in peace. And there's another vision that says, I got to protect myself against Americans with guns. And therefore we're going to have more and more guns. And police officers are at risk, ambulance drivers are at risk, teachers are at risk. But it ain't going to happen if just this group is going to be the one always speaking. You have to register, you have to take those cards, you have to sign. I can see the change in our society, I can see people getting pissed off. And what I told the NRA a year ago, you better compromise and reach out with your hand at the olive branch. We are reaching to you for compromise. Because you are on the losing side of history. 300 million guns, we're going to have more and more massacre. And you don't need to be a prophet to predict that. I am not a prophet. And sure enough, they're happening. We're going to have more new towns. We will have them. Let's not put our head in the sand. There are going to be more new towns. So what are you going to do about it? Thank you.
Thank you, Teny. I want to recognize a couple of other individuals who have joined us. Seth Magazino, who is here, a candidate for Secretary of, General Treasurer. Jorge Alorza, who is a candidate for Mayor of Providence. Appreciate them being here. Nelly Gorbea, candidate for Secretary of State, and thank them all for being here. Our final speaker that I want to invite up here is my uncle, who's actually, prior to about 2 months ago, he was the Executive Director of Newport County Mental Health. Part of this piece of legislation was really balancing the important interest of protecting privacy rights of individuals who are suffering mental illness and how we create a system or incentivize the creation of a system so that information goes into the NICS system. And he was an informal consultant during the development of the legislation. I would like him to come up and just say a few words.
Thank you, and I too want to thank the Congressman for both his interest and leadership in this very important issue. I think it's tremendously important for the future of our country that we have legislation that helps guide and present some principles by which we can live so that we can all be safe. I want to say that I'm a clinical psychologist. I've been a mental health advocate for many, many years. In fact, I was part of an initiative in the state of Rhode Island to change the mental health laws to allow people to live in the community as opposed to being institutionalized. Back in the 60s, we had as many as 3,000 people at our Institute of Mental Health in Cranston. And now, for the last 15 or 20 years, there's been no more than 150, 200 people in the hospitals. So we've transferred, if you will, and transposed the system into a much more of a community-based system. At the same time, I'm keenly aware that there are people who, when they're in the throes of mental illness, particularly if they're psychotic and they're experiencing paranoia and delusions, where their capacity to understand the reasonableness of their actions is considerably diminished. And they should not have easy access to rifles, guns, other equipment that can cause violence and harm to others. And in their best interest, it's really a good idea to have some constraints over that access. And I think this legislation is in the right direction. I agree 100% with Teny Gross that we probably are not going to be able to eliminate it all. Somehow that's still a major challenge, but we do need principles and guidelines, and this is an important step in that direction, and I think it will be very helpful, and I appreciate what's happening in Congress and even what's happening in the state of Rhode Island to begin to understand and manage this particularly important issue. So as mental health professionals, I think we have a responsibility to join with law enforcement and other members of the community in preventing further violence. I don't think, I made a statement several months ago about the fact that there is some agreement, notwithstanding what Teny said, between the NRA and the PTA about gun violence. The problem is they just haven't agreed on just how that should happen. So I think all of us are concerned about violence in our society, and I think this legislation helps provide some real guidelines in helping to prevent it in the future. So I appreciate what the Congressman's doing, and I thank you.
So I want to just really quickly, because a couple of people have joined us, I just want to really quickly recap what the bill does. Under current law, an individual struggling with severe mental illness who is only federally disqualified from purchasing a gun if that person has been involuntarily committed through a legal process or adjudicated mentally ill. In other words, an individual is not currently disqualified on the federal level from purchasing a firearm, even if they have been temporarily held because they are dangerous or it has been determined by a mental health professional that they are likely to cause harm to themselves or others. And so that is really, I think, shocking to most people. This bill expands the federal firearm disqualifications. It encourages states to set up a reporting system to include that disqualifying information. It has important patient protections, and it supports mental health professionals who learn this information and would like to, in fact, report it but don't have a current means to do it. And as Teny said, this is an important fight. There are many efforts underway at the local, state, and national level trying to do this. But I suggest that this bill, the End the Purchase of Firearms by Dangerous Individuals Act, is a very pragmatic approach to this that respects the Second Amendment, that respects the right of privacy of people suffering mental illness, but puts into place a system to be sure that these individuals who are dangerous to themselves or others don't have the ability to go and buy a gun and create the kind of tragedies that we've seen in our country. So thank you all for being here. Thank you for your work. And now let's continue to promote this. And I'm happy to take questions.